What is the ethical balance between beneficence and autonomy? Imagine you're in a situation where a doctor believes a certain treatment could save your life, but you decide to refuse it. How do healthcare providers handle this kind of conflict? That's where the balance between beneficence and autonomy comes into play. Beneficence is about doing what is best for the patient, promoting their health and well-being. Autonomy is about respecting the patient's right to make their own choices, even if those choices differ from medical advice. These principles often work together but can sometimes clash. For example, a doctor might think a treatment is necessary to prevent serious harm, but the patient might refuse because it conflicts with their personal beliefs. The key is to find a way to respect the patient's right to decide while still acting in their best interest. To do this, healthcare providers focus on informed consent. This means giving patients clear, easy-to-understand information about their condition, treatment options, risks, and benefits. When patients understand their choices, they can make decisions that truly reflected their values. Another important element is competence. Patients must have the mental ability to understand the information and make decisions. If a patient is not competent, healthcare providers may need to act in their best interests, guided by beneficence. Voluntariness is also vital. Patients should make decisions freely, without pressure or coercion from anyone. Shared decision-making combines the expertise of healthcare providers with the patient's personal values. This approach encourages open conversations where both sides work together to choose the best course of action. Sometimes, patients refuse treatments that could save their lives, which puts healthcare providers in a tough spot. They must carefully evaluate the patient's capacity, the risks involved, and the possible benefits. The goal is to respect the patient's autonomy while also fulfilling the duty to promote their health. In the end, balancing beneficence and autonomy means respecting a patient's right to decide while ensuring they are well-informed and capable of making those decisions. It's about finding a middle ground where the patient's choices are honored, but their well-being is still protected. This balance helps make healthcare both ethical and effective, ensuring patients are cared for in a way that respects their personal values and health needs.